When we talk about ending the institutionalisation of children, often people will ask the question, well, what's wrong with institutions? And I think part of that is because perhaps we've forgotten our history. Many of us in the UK, in Sweden, in the United States, in other developed countries, forget that we moved away a very, very long time ago from delivering institutions and orphanages. And the reason we did that was because they are harmful to children. So we need to bear this in mind when we are thinking about what other countries are doing in terms of delivering services to children and families. And when we hear the term orphanage, we mustn't think this is a benign thing or a necessary thing, because actually we know that we can do without them, and we know that no matter how hard they try, they can't replace a family. So what's wrong with institutions? Well, our president and founder, J.K. Rowling, I think probably says it better than anybody else could in this video.
Around the world, there are 8 million children living in institutions, often known as orphanages. But most of these children have families who love them and want them. How can this be? The problem is that in many countries, health, education and social services are not set up to meet the needs of all children, and many fall through the gaps. In some cases, if a family is poor and cannot afford to feed their children, or they have nowhere to live, there are no social services to provide material support or housing. So parents feel they have no choice but to put their child in an institution where they will at least have food and shelter. But children need so much more than just food and shelter. In other cases, if a child is born with disabilities, doctors will advise parents to put their child in an institution, and not having any other options, the parents follow their advice. Often the institutions are located far away from the homes of the families, and if the families are poor, they struggle to visit their children. As a result, relationships gradually break down until the child and family are like strangers to each other. Once in the institution, children's needs simply are not met. The personnel are usually good people in a bad situation. With too few of them to provide proper care, they do the best they can, providing the absolute minimum to each child. The children are fed, bathed and changed at specific times, and otherwise left to their own devices. With very little physical and emotional contact with others, feeling unwanted and unloved, the children withdraw from the world around them. Research shows that this harms the development of their brains and can cause both disabilities and behavioural problems. The system creates more problems than it solves. Institutionalisation exists on a massive scale, and there are so many aspects of the system that need to be fixed that, at times, it can seem like an impossible problem. But thankfully, Lumos knows the solution and is already hard at work solving the problem.
So why is this a problem? Well, actually, the best evidence that's available suggests there are approximately 8 million children in institutions and so-called orphanages around the world, and that more than 80% of those children are not orphans, but they have at least one living parent. At the same time as that, there is now a great deal of evidence about the harm caused by institutionalisation. And in particular, in recent times, we have seen evidence of the serious impact of institutionalisation on the developing brain. Babies who are institutionalised do not develop in the same way as other children, and in particular their brain development is harmed by institutionalisation. We also see research from across the world found, in fact, that in low, middle and high income countries, children in institutions were at a much higher risk of all forms of abuse and exploitation than their peers raised in families. And if we look at disabled children, we see very significantly increased mortality rates in many institutions. And again, these are not always in the poorest of countries. We have seen problems of this kind in countries in the European Union. And finally, those children that do survive institutionalisation and move on to the outside world as young adults actually struggle seriously to cope in the outside world and in normal society. And we find that there are extremely poor outcomes for adults who were raised in institutions. If we look at disabled children, there was a pretty shocking piece of research done across many countries in Europe about 10 years ago. And this, amongst other things, looked at the children under 3 in institutions. And it found that of children who had left the institutions, 0.29% of those children who didn't have disabilities had left the institution because they had died. But actually 28% of the children who had disabilities had died, and that was the reason that they had left the institution. And what that means is that children with disabilities were 100 times more likely than those without to die in the institution. So why is it that children with disabilities are at so much greater risk than children without in institutions? Well, there are a number of reasons. And one of them is that kids with disabilities often need a much more intensive support and help to do basic things like eat a meal, drink, dress themselves. And where you have very few members of staff who have limited time, then the impact on children with disabilities is much, much greater than children without. But we also find in quite a lot of institutions in many different countries, we find an attitude problem. We find this idea that the children with disabilities are essentially warehoused. And when we worked in one institution inside the European Union where there were very high rates of mortality for children with disabilities, we asked the director why she thought this was the case, and she said, "You must understand, these children are sent here to die. The average life expectancy of one of these children is 11 years. If a child lives any longer, we feel we've done an exceptionally good job. No child is born to die, and no child is sent to an institution to die. And we know from our work that by providing additional support to children with disabilities, their life expectancy is much, much longer than 11 years. And then we move on to what happens when young people leave institutions. Well, unfortunately, there's not a huge amount of evidence. There's not a lot of work done to follow up the young people once they've left institutions. But we've seen a number of studies from different countries that have some fairly striking and significantly similar outcomes for those young people. And in one country where many children were followed up as adults once they'd left the institutions, they found that actually they were 10 times more likely than their peers to be involved in prostitution, 40 times more likely to have a criminal record, and 500 times more likely to take their own lives than the children who had been raised in families. And in Moldova, for example, another study found that young girls who had been raised in institutions were 10 times more likely than their peers to be trafficked for the purposes of sexual exploitation. So the challenges are huge. And we also have plenty of evidence now from great researchers that explain in some detail how that change, how institutionalization is having a negative impact on the development of children. And some of the research from Harvard is perhaps the best that we have seen.
And with all the problems that families have, and we've all grown up in families, or most of us have grown up in families, so we know what some of those problems are. It is still the best constellation of human relationships to care and protect children on a daily basis. And unfortunately, we do know that the global burden is significant. There's approximately 18 million children who have lost both parents. We know that probably 80% of the children in most countries, in orphanages, for example, have family, parents, aunties, uncles, others who could care for them, but it's poverty that's driven them there. For example, in a country like Indonesia, where there's 500,000 children in orphanages and 80% have families, they're there because their families had to strike that Faustian bargain between having their kids go to school and go to an orphanage in order to accomplish that, or stay home and not be able to go to school because of poverty. This is a slide that you may not be able to see clearly, but I would refer you to UNICEF Inequities in Early Childhood Development, what the data says, because it is a good compilation, or the best compilation we have to date in terms of children living outside of family care. The Bucharest Early Intervention Project took place in Romania after the end of the Cold War, and it really revealed huge numbers of children, hundreds of thousands of children in orphanages. They've been put there to accomplish certain political and social goals. The country went broke, and the world sort of stepped in and saw these kids in horrendous conditions. When the research took place, the kids have actually been moved to orphanages that were better, and or the orphanages they were in were improved. So it wasn't the worst of the worst scenario. And essentially the researchers looked at kids that were in institutions, and then they looked at children that were in families around the corner from the institutions. And what they found was kids growing up in families had an average IQ of 103. Children inside the orphanages had an average IQ of 64. I mean, that's a huge difference. And this slide here really on the right shows a brain scan of children in families, and you'll notice the orange, large percentage of orange and yellow. And now go back to that first video that we saw, and there's lots of energy taking place in these kids. This is what an IQ of 103 looks like. There's lots of capacity, lots of stuff going on. If you look at the one on the left, there's just these two little nodes of orange, and this is of a child, a brain scan of a child who grew up in an institution with the IQ of 64. And you'll just see there isn't the capacity, there isn't the energy, there isn't the range of capacity that kids and families have. Now, what the researchers found is when you move children from orphanages to families under the age of 2, several years later, their IQs had increased into the 90s, high 90s and whatnot. So the good news is that things did improve dramatically, capacity of intellect, but not all the way. And when you waited till after the age of 2 and you moved children from the orphanages into families, what you saw again was a gain after several years, 78s into the low 80s. But again, that critical phase of development, they didn't regain all of their capacity. And so there is this critical phase that we have to be very, very cognizant of.
Another fundamental question that people ask us is, what do we mean by an institution? And part of the problem with that is that everybody thinks an institution is about numbers. And no one can come to a clear and agreed decision as to what number becomes an institution and what number is good quality residential care. And that's because actually the number of children in an institution isn't actually the most important point. We know that the bigger the number of children, the harder it is to care for them well, but actually it is more the culture and the way that children are cared for that has an impact on their health and development. And so we prefer to talk about an institution as being any residential care which has an institutionalised culture. And what we mean by an institutional culture, the definition that's been accepted in Europe now, includes 3 or 4 key components for children. And the first one is that the children are isolated from the broader community and they're compelled to live with people to whom they're not related. The children and their families don't have sufficient control over their lives and over decisions that affect them. And the requirements of the organisation tend to take precedence over the children's individual needs. Well, now, what do we mean by that? What we mean by that is if you're one member of staff looking after 20 children and they all need feeding, and you've only got half an hour to do it, then those children will each get 1 minute 20 seconds to eat their meal, no matter what. They will be given their meal at a particular time, whether that is when they're hungry or not. If they wet their nappy and it's 3 or 4 hours to changing time, they will lie in a wet nappy, perhaps in a freezing cold facility for hours on end, in pain, in discomfort. If the babies cry, their cries will not be responded to because there isn't a member of staff who has the time and availability to come and do that. And what we find with babies, particularly with the newborns, is that for the first 2 or 3 days in an institution they will cry when they need something, but then they become silent because their cries are not answered. And what happens as a result is that the staff think that the children are well behaved and they think we've got great babies here, they're very good, they're very quiet, but actually what's happening is that baby is lying there in pain, in fear, in discomfort, and needs the comfort and the stimulation of a loving and caring adult and is not getting that, and that is where the problems start. And the fourth and key point of what institutional culture means for children is that the children are not able to form the essential attachment to the one or more consistent loving caregivers who are usually parents, and it is that attachment that provides the building blocks for growth, for development, and for the establishment of all future relationships. And so that institutional culture, what is included in that definition, therefore, of institutions? And I'm going to go through these because I think it is important, because sometimes people do not include all institutions in a definition, and that's for a number of reasons. So usually when we talk about institutions, this includes the following. Large residential units. Well, what do I mean by large? I know that if you have more than 10 children in a residential unit, no matter how hard you try, it's very, very difficult to make it feel like a family. And countries that are providing high quality residential care are usually providing that in numbers of 4 or 5 or 6. But we also include in that smaller units, smaller homes even than 10, but that have these very strict and institutionalised regimes that result in that same institutionalised culture we referred to earlier. We include in this the sort of residential units for children who've committed minor offences. So in many countries, we see the incarceration of children who perhaps have stolen a loaf of bread, perhaps have committed some kind of minor infraction that's got them in trouble with the law, where with a little bit of community support, we would stop them from committing any further offences. And they're not actually a danger to society, but the societal response is to lock them up into residential units. In our definition, we also include residential health facilities. What do I mean by that? I don't mean hospitalisation of children that is necessary, but I do mean that if a paediatric ward, for example, or a maternity ward becomes somewhere where children are left for long periods of time and are not there for health reasons, but they are there because there is nowhere else for them to live, then essentially that becomes an institution and the children develop institutional behaviours. Other examples of residential health facilities that we have come across are specialised baby institutions. So when people believe that children with disabilities or chronic illnesses, that babies with those disabilities or chronic illnesses need to live in a hospital-like environment, often they set up specialised baby institutions and will argue that this is the only way these children can be cared for. But of course the evidence shows that unless the child is in a family environment, they will not thrive physically, emotionally or developmentally. And we also include other facilities that sometimes are anachronistic. They've been perhaps functioning for a very long period of time, and health systems think they need to continue to function. So for example, residential sanatoria for children who have tuberculosis. Another thing we've come across in a number of countries is institutions that segregate children who are HIV positive or who are suspected as being HIV positive. And again, this is to do with stigma, and it's to do with a lack of understanding of the way in which HIV is transmitted. But all of these ultimately are forms of institutionalising children. The intention is usually very good, but the outcome for the children is not. And finally, it's really important when we're counting the numbers of children in institutions and planning change for them that we include residential special schools. In many countries, so far they've not been able to develop inclusive education for children with disabilities so that disabled children can be included in the mainstream schools in their own communities. And as a result, even children with mild disabilities are separated from their family at an early age and sent to residential special schools, often many hundreds of kilometres away from the family home. It can make it really difficult for families to visit, and sometimes the relationship with the child breaks down. What we often find as well is that the conditions in the residential special schools are not very good, that the child is so traumatised by being separated at the age of 6 or 7 from their family and taken to this strange environment that they do not learn well, and that the educational outcomes are also not good for children. And in countries where we've helped to introduce inclusive education, we see much better educational outcomes for children once they come out of the residential special schools, back to their families and into the mainstream schools alongside their peers. So we must remember, in any country, when we are trying to plan to end institutionalisation, to make sure that we include all of these different facilities in our calculations and that we don't miss any children out so that no child is left behind.